We've been in business now since 1998. Initially, I was director of a nonprofit treating sexually abused children, and we began to measure outcomes. I found that was very useful going for funded. The overall cost of care tends to go down because the resources being allocated in a more direct manner to the patients who most need it, and subsequently we see greater benefit.
At its core, our mission is to improve treatment outcomes.
We know that clinicians are the biggest source of variance in treatment outcomes. We know that if we give them the tools, they can improve those outcomes. The questionnaires are a result of a collaboration of hundreds of clinicians, organizations. We're looking for that balance between the ease of use, the speed at which a client can complete the questionnaire in the waiting room, and the value of the information. 10 to 15 items gives you a lot of measurement. We know for every item how people who are receiving mental health services tend to answer it, how much improvement do we expect on that item. We know it, by diagnosis, by sex, by age. We can assure that even though the items may be different on one form or another, the measurement remains the same. We can design a questionnaire specifically for the measurement needs of that organization or that population we're trying to measure, and we're constantly testing our questionnaires, refining them.
When your patient fills out one of these questionnaires, that questionnaire has been carefully built based on data spanning hundreds and thousands of other patients.
The toolkit is essentially a clinician's way of making sense of all the data that we process.
Toolkit gives them ways to look at results in aggregate. They can see how their outcomes compare to benchmarks of other clinicians, national norms. They're also able to look at individual cases. They can look at change over time. They can look at risk indicators, subscales, to identify those patients that are perhaps at risk. Also identifying those patients that are doing very well. We have a staff that are good at doing this. They're dedicated to it.